Dosulepin is a tricyclic antidepressant commonly used only in patients for whom alternative therapies are ineffective due to its toxicity potential. In this video, let's find. What is Dosulepin? What is Dosulepin used for? Contraindication. What are the side effects of taking Dosulepin? How does Dosulepin work? How to use Dosulepin? What is Dosulepin? Dosulepin, also known as Dosulepin and sold under the brand name Prothiaden among others, is a tricyclic antidepressant which is used in the treatment of depression. It acts as a serotonin-norepinephrine reuptake inhibitor, SNRI, and also has other activities including antihistamine, antiadrenergic, antiserotonergic, anticholinergic, and sodium channel blocking effects. What is Dosulepin used for? Indicated in the treatment of symptoms of depressive illness, especially where an anti-anxiety effect is required. Contraindication. Contraindications include epilepsy, as it can lower the seizure threshold. TCAs should not be used concomitantly or within 14 days of treatment with monoamine oxidase inhibitors due to the risk for serotonin syndrome. Acute recovery phase following myocardial infarction, as TCAs may produce conduction defects and arrhythmias. Liver failure. Hypersensitivity to Dosulepin. Side effects. Common adverse effects. Drowsiness. Extrapyramidal symptoms. Tremor. Disorientation. Dizziness. Paresthesias. Alterations to ECG patterns. Dry mouth. Sweating. Urinary retention. Hypotension. Pharmacodynamic. Dosulepin is a tricyclic antidepressant that interacts with various receptors and transporters. It is a monoamine reuptake inhibitor with approximately equal potency for noradrenaline and 5-HT that increases the availability of these neurotransmitters at the central synapses. The metabolites of Dosulepin are shown to inhibit 5-HT uptake by the human blood platelet. Mechanism of action. By binding to noradrenaline transporter, NAT, and serotonin transporter, SERT, in an equipotent manner and inhibiting the reuptake activity, Dosulepin increases the free levels of noradrenaline and 5-HT at the synaptic cleft. It is shown that the main metabolite norepinephrine is a more potent inhibitor of noradrenaline uptake than the parent drug. Dosulepin displays affinity towards alpha-2 adrenoceptors and to a lesser extent, alpha-1 adrenoceptors. For inhibition of presynaptic alpha-2 adrenoceptors by Dosulepin facilitates noradrenaline release and further potentiates the antidepressants. It also downregulates central beta-adrenoceptors by causing a decline in the number of receptors and reduces noradrenaline-induced cyclic AMP formation. Dosulepin binds to 5-HT1A and 5-HT2A receptors in the cerebral cortex and hippocampus as an antagonist. 5-HT1A receptors are autoreceptors that inhibit 5-HT release, and 5-HT2A receptors are GI/Go-coupled receptors that reduce dopamine release upon activation. Antagonism at 5-HT2A receptors may also improve sleep patterns. Dosulepin also binds to muscarinic acetylcholine receptor and causes antimuscarinic side effects such as dry mouth. By acting as an antagonist at histamine type 1, H1, receptors, Dosulepin mediates a sedative effect. Main metabolites northiaden, dosulepin sulfoxide and northiaden sulfoxide may also bind to 5-HT, alpha-2 and H1 receptors, although with less affinity compared to the parent drug. Half-life. The elimination half-life is approximately 20.4 hours following oral administration of 25 mg Dosulepin. Dose. Dosulepin comes in two different strengths, either 25 mg capsules or 75 mg tablets. The usual dose is depression, 75 mg to 150 mg a day. Your dose may gradually go up to 225 mg a day if your specialist recommends it. The maximum dose for depression is 225 mg a day pain relief or preventing migraines, 75 mg a day taken in the evening. Your dose may start at 25 mg a day and gradually go up to 75 mg a day. The maximum dose for pain or migraine is 150 mg a day. Safety advice. Epidemiological data suggests that the use of tricyclic antidepressants in pregnancy may be associated with an increase in preterm delivery. That's all the information about Dosulepin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.